Local anesthesia. Today we'll discuss the definition, ideal requirements, and the theories on local anesthesia. Starting with definition, reversible and transient loss of sensation in circumscribed area of body. So first of all, anesthesia is for loss of sensation. So we'll mention how it is. It is a reversible and transient loss of sensation. Now where does it act? Circumscribed area of body. How it is caused? It is caused by depression of excitation in nerve endings or by an inhibition of the conduction process in peripheral nerves. Basically, there will be nerve conduction which will be inhibited or depressed by the local anesthetic agent. Ideal requirements of local anesthesia. So, local anesthesia should not cause any irritation or toxicity to our body. So, systemic toxicity should be low. It should not be irritating to the tissues. It should not cause any permanent alteration to the nerve structure. Whatever it is causing, the alteration must be temporary in nature and it must be effective when applied locally. So once we are applying it locally, it should be effective and the time of onset must be short, whereas the duration of action must be long enough to complete the procedure. Once we incorporate local anesthesia, it should start acting right away, but the action should be maintained throughout our procedure in full potential. Again, it should be stable in solution and readily undergo biotransformation in body. So outside the body, it should be stable. Once it enters the body, it should undergo required biotransformation immediately. And it should be sterile or be capable of being sterilized without deterioration. That is important, and potential enough to provide complete anesthesia with minimal dosage. Even if we are using minimum dosage, it should provide full potential. So these are the ideal requirements. Next, we'll discuss the theories of LA. So there are 5 theories which you can remember by using the mnemonic: security CAMS, security for specific receptor theory, C for calcium displacement theory, A for acetylcholine theory, M for membrane expansion theory, and S for surface charge theory. First of all, we'll explain specific receptor theory. This is the most accepted theory. Now, what does it propose? It proposes that anesthetic acts by binding to specific receptor on sodium channel, and the action of drug is direct in nature. So here they are saying on the sodium channels there are specific sites or receptors for anesthetic agents, and it is not mediated by any kind of response. The action of drug is direct. Now, how is this the most accepted theory? Because many studies were conducted and these studies indicate that specific receptor sites for local anesthetic agents exist in sodium channel, either on external surface or internal axoplasmic surface. So there are receptor sites proven which can be seen either on the external or internal axoplasmic surface. Okay, we'll explain with the figure. Here you can see there is an axonal membrane through which a sodium channel is passing through, and there you can see a red color dot which is your LA receptor. Now once the LA binds to the receptor, it inhibits the sodium from being transported. Calcium displacement theory, according to which LA causes displacement of calcium from membrane site and this alters permeability of sodium. So here they stated LA, it will displace the calcium present on membrane and that will alter the permeability of sodium. But here a controversy was that even when they varied the concentration of calcium ion, it did not alter the local anesthetic effect. Acetylcholine theory, according to which LA occupies acetylcholine receptor sites without exciting them and thus making the receptors unavailable for nerve secretions. So here acetylcholine is considered to be responsible for neural conduction and LA takes place of the or replaces acetylcholine in receptor sites. But controversy is that acetylcholine is not responsible for neural conduction. Next is membrane expansion theory, according to which La molecules diffuses to hydrophobic region of excitable membrane, and this causes disturbance of the membrane. Now this will lead to expansion of membrane, which will prevent the permeability of sodium ions. Here controversy was that it only explains the activity of uncharged anesthetic like benzocaine. I'll explain in detail with figure. Here you can see there are lipid membranes on the cell, and there is a sodium channel in between this lipid membrane in the first part of the figure. Once you apply the La like benzocaine, it will act on this membrane, and what happens, it will bring some changes which leads to the expansion of membrane. Naturally it will constrict the nearby channel because membrane expand and the channel gets constricted, so it will prevent sodium from being depolarized, sodium from passing through these channels. So this is basically the membrane expansion theory, but it's not accepted. Surface charge theory. This is the last one. Here it was stated that La binds to nerve membrane, and then it alters the membrane potential, which decreases the excitability of nerve. So here they are saying La will directly bind to the nerve membrane, and thus it will alter the membrane potential, and the nerve will not be excited, or it will decrease the excitability of nerve. Controversy was that resting potential is not altered by La, and it can't explain the activity of uncharged anesthetic like benzocaine. In membrane expansion theory, they could only explain the activity of uncharged anesthetic like benzocaine. So that's all. The questions will be: define local anesthesia, what are the ideal requirements of La, expand on the theories of La. This can be asked individually as a 8-mark question or a short note, and make sure you're drawing figures wherever necessary. You don't have to follow the textbook figures, but yeah, something which is legible. Don't forget to like, share, and subscribe. And if you feel any topic on which more discussion is needed, kindly comment below. That's all. Thank you.